Primary Care Network is a series of GP practices that are all working together. We very much want our work to be place-based, so Central Network, of which Marshalls Cross is a part, is located within the centre of St Helens. Traditionally, GPs have worked in isolation. There's been just the GP assisted by his practice nurse. In St Helens, we've got a shortage of GPs, which is mirrored across the country. However, in St Helens, we've got more of an acute shortage because a lot of us, like myself, are over 55 and will shortly be retiring. So we have to work differently. To do this, it's best for us to work together, and we need to know what the needs of our local population are. Smoking is an issue which leads to an increase in a lot of chronic diseases, most notably COPD, which is chronic obstructive pulmonary disease. There's a lot of deprivation in the area, and we need to address the obesity situation. Been in place about 2 years, and we're starting to see things come together and work quite well. We have IT systems that don't necessarily talk to each other. We have lots of other people involved in patient care pathways now, so we need to think about the security and confidentiality of all the patients' records. There's a resistance to change by everybody who's been working for a long time. All the GPs do a good job, and it's to encourage them to share that good practice and to eliminate the variation between surgeries. And I think, our greatest achievement to date has been working together on what we call phase 1 and phase 2 of the COVID vaccination program. And it goes to show how we can all work together to create the service that was at Saints, where people came down in their thousands and gave us excellent feedback, and we were one of the first to get all our eligible populations vaccinated throughout the entire country. So we have to think differently, and to do this we have to use professions allied to medicine. We have to utilise physiotherapists, clinical pharmacists, physicians associates, nurse associates, occupational therapists and others. We call these additional roles. What we hope is that these will take the burden off our reducing GP population and enable people to be seen swifter, enter the right pathways appropriate for their treatment sooner, and generally have a better outcome for their health needs. What I hope to see is that we can reach the people who are hardest to reach. One thing the COVID vaccination program showed us that is we have a lot of housebound patients. A lot of these patients have multiple chronic diseases that require careful monitoring, either by blood tests, blood pressure monitoring, and just general observation. It is time consuming to get people out there. However, if we can recruit this additional team, we can send them out, they can take the basic observations, and with modern technology such as video phones, if there's an acute issue, development of a rash, development of ankle swelling, the clinician can speak directly to the doctor and produce the video consultation that negates the need for the doctor to spend time travelling to and fro. The government instituted an initiative which we call the Care Home Project. This involves those people with generally multiple physical conditions and a lot who are incapacitated mentally, such as those with dementia, that require regular observation and care. We are hoping that we can form our additional roles into a team who will go out and provide an overall excellent standard of care for all their needs. In summary, primary care is currently under an incredible workload that we've never experienced before, and we know that winter is coming. Not only do we have all the diseases that come with winter, but we also have to consider phase 3 of the COVID vaccination and the flu vaccination program. So how are we going to achieve this? We're going to achieve this by utilising our team, which I hope to have in place within the next 2 months, that will take some of the workload away from the GP and the practice nurse, who can then focus on acute care and the vaccination programs.